One note I didn't mention about the EKGs is that you will not be having to visualize an EKG for your NPLEX exam. It is an important skill as a physician, but you will not have to be visualizing an EKG and interpreting those reads on an NPLEX test. So the lymphatic system is a one-way network of vessels, tissues, organs. It runs parallel to the cardiovascular system and it carries lymph fluid, which is derived from excessive interstitial fluid that the capillaries don't reabsorb. There's no central pump, there's no heart. It relies on hijacking skeletal muscle contractions, respiratory movements, and smooth muscle and vessel walls, and provides one-way flow only from the tissues back to the heart. And it's a lower pressure system than the venous system. There's three primary functions: fluid balance, immune surveillance, and fat absorption. So, from a fluid balance perspective, it returns excessive interstitial fluid to the bloodstream. Without this, edema would occur. It also filters lymph through lymph nodes where the pathogens and any foreign particles are detected and destroyed by lymphocytes and macrophages. And there's specialized lacteals in the small intestinal villi that absorb dietary fats as chylomicrons. Fats are then transported via the lymph called chyle to the bloodstream via the thoracic duct. Our lymphatic capillaries are the small, highly permeable vessels found in most tissues. Endothelial cells will kind of overlap like a loose roof shingle, and they form these one-way mini valves. There are anchoring filaments that connect these capillaries to the surrounding extracellular matrix, and the tension on them pulls them open during edema, allowing for proteins, debris, bacteria, and larger molecules to even enter. This is different than blood capillaries, which we really can't have those larger structures just go right on in a capillary system. A collecting lymphatic vessel is larger. It has some smooth muscle in the wall and it has valves like veins inside of the lumen that prevent backflow of lymph. And smooth muscle contracts rhythmically to propel lymph forward. Your major lymphatic ducts are your thoracic duct and your right lymphatic duct. The thoracic duct is the largest lymphatic vessel and it drains everything but the right chest, right arm, and right head and neck. The right chest, arm, and head and neck is drained by the right lymphatic duct into the right subclavian vein. Lymphedema is a condition where there's obstruction or damage to lymphatic vessels, and that can lead to chronic swelling, oftentimes seen after a lymph node dissection in cancer surgery. Lymph nodes are these bean-shaped organs. They're located along lymphatic vessels. They have an outer cortex with B lymphocyte follicles. They have a pericortex where our T lymphocytes are, and a medulla where there's these medullary cords. There are afferent lymphatics, which bring lymph in, and efferent lymphatics, which carry lymph out at the hilum. The lymph nodes filter lymph via macrophages. Well, they'll phagocytose pathogens, debris, and foreign particles to present. They then can activate the immune system via antigen-presenting cells like dendritic cells, presenting antigens to T cells, which leads to an adaptive immune response. And activated B cells can differentiate here into plasma cells producing antibodies. Lymphadenopathy is an enlargement in lymph nodes, and it could indicate an infection, an autoimmune disease, or even a malignancy. And a sentinel lymph node biopsy is the first lymph node to receive drainage from a tumor site, and this is often what's sampled first to check for metastasis. The spleen is the largest lymphoid organ. It's in the upper left quadrant of the abdomen, and it has red and white pulp. The red pulp has sinusoids and cords of Billroth. It's essentially the site for blood filtration, versus the white pulp is lymphoid tissue that's surrounding central arterioles, which is the site of immune function. It will filter the blood by removing old and damaged red blood cells or platelets using macrophages. It also has immune function by trapping blood-borne antigens with B or T cells. It can store some blood and contract during sympathetic stimulation like stress or exercise. And it does some hematopoiesis during fetal lifetime. The spleen produces blood cells. Splenomegaly is an enlarged spleen. You can see this in an infection like mononucleosis or even in conditions like portal hypertension or malignancy. Splenectomy is the removal of the spleen, where you're then at increased risk to an infection by an encapsulated bacteria like strep pneumoniae or Haemophilus influenza. And then hypersplenism or even Neisseria meningitis. Hypersplenism is an overactive spleen that's destroying blood cells too quickly, and we see this in anemias, thrombocytopenias, or leukopenias. The thymus is a primary lymphoid organ like bone marrow. It's essential to mature our T cells. It's in the anterior mediastinum, superior to the heart, and it has lobules that include an outer cortex and an inner medulla. The cortex is where our thymocytes, our immature T cells, undergo positive selection. They have to be able to recognize our own major histocompatibility complexes so they can be activated later in life. And then in the medulla, T cells undergo negative selection, where they make sure they don't react too closely to self-antigens to prevent autoimmunity. Hassel's corpuscles are these concentric whorls of epithelial cells that are unique to the medulla of the thymus. And it's really largest and most active in childhood, but then it undergoes involution or atrophy. It shrinks after puberty. Mucosa-associated lymphoid tissue or MALT is diffuse lymphoid tissue that's embedded in mucosal surfaces throughout the body. This would include our tonsils, our Peyer's patches, appendix, and even bronchial-associated lymphoid tissue. And it's often our first line of immune defense at these mucosal barriers. They have IgA antibody producing B cells and T cells that respond to locally encountered antigens.